Hi everyone, my name is Dr. Jennifer Jackson. I'm a registered nurse and assistant professor in the Faculty of Nursing at the University of Calgary. And I'm thrilled to be joining the Food for Thought breakfast seminar series to tell you a bit about my research and make some arguments for why we need to reconsider the structure of nursing work in our modern profession. So in my research, I've asked questions like, what is it that nurses do? Not what do we plan that they do or schedule or create policies that they do. What are they actually doing on the ground? And from asking those questions, I have generated some big ideas about nursing. So I have thoughts about what types of work are nurses doing? What types of labor does this work require? And what types of adaptations are nurses creating to make this work and this labor all happen? And because of these things, what is the consequences for the health system? So I'll tell you a bit about how I came to those ideas and also how I'm extending them now with work in community services and harm reduction practice to see how ideas may or may not translate from hospital settings. So I'm looking forward to having a discussion with all of you about big ideas in nursing, and I'll see you soon for our breakfast series. Thank you.